We asked for your questions about these new weight loss medications, and you sent in hundreds of them, the most common being around side effects. Now, as I answer this, I want you to keep in mind that one of the ways these drugs, these GLP-1 drugs work, is to slow down how quickly food will move through your gut. So perhaps no surprise then that the most common side effects are things like nausea and vomiting and constipation. It's part of the reason doctors will slowly increase the dose, allowing your body to get used to it. Now, about 1% of the time it can be more serious, an actual bowel obstruction, stomach paralysis, pancreatitis. You may remember there were also some concerning anecdotal reports that people were thinking about suicide while on these medications, but a recent study did not show an increased risk of this. It's early days still. These medications are not for everyone, but they do appear to be mostly safe with those caveats. How long can you stay on these medications? Well, the medications mimic this hormone that are released after you eat a meal. Basically makes you think that you just ate, even if you didn't. It's called a post-nutrient hormone. Now, these were actually approved back in 2005 to help people with diabetes control their blood sugar, and they were subsequently found to also lead to weight loss. There's two important things that were learned. First of all, long-term safety data on these medications looked pretty promising, and the expectation was these patients would stay on these medications for the long haul. Now, I will say there are newer drugs, there are newer doses, and there are more people than ever who are now taking these medications, so we're going to learn a lot more. But for weight loss, at this point, there are no hard and fast answers for how long a person could or should stay on them. It is possible that people stay on these medications for a long time, just as they would for diabetes. What happens when you stop taking these weight loss medications? That is the million or perhaps billion-dollar question here. Many studies have shown that people do regain the weight after coming off the meds. I realize that's disheartening to hear, but it's a bit nuanced, different for different people. This recent study, for example, showed that 1 year after stopping Ozempic, about 20% of people maintained some of their weight loss, 36% of people continued to lose weight. Now, it's not clear what those people may have been doing differently, but it is clear that the medications also do require pretty dedicated lifestyle changes. It's not a magic pill or a magic injection in this case. It's going to take a few more years of study to sort out who is who's going to benefit the most. And if you want to continue to learn more about this, follow my podcast, Chasing Life. We're exploring weight and weight loss all season long.